Hi, I'm Emma Anderson, reporting analyst for Civic and lead analyst for the newly revamped Telehealth Services Analysis, an interactive dashboard which provides detailed information on telehealth services prior to the onset of COVID-19 and its subsequent impact. This report is updated regularly to enable users to track trends in telehealth services over time and the impact on cost and utilization. Since this was an already existing report, the first steps to this update were to determine what gaps in information the audience may be interested in that was not addressed last time around, and what user experience functionality may be able to be improved. This includes streamlined navigation between the different dashboards of the report and clearer language to describe some of the charts or tables displayed. After all of the feedback was gathered and discussed by our team, we began to create mockups to improve the design of the Tableau report. The table of contents is a new addition where users are now able to view the different metrics for the analysis and select where they would like to dive into the report. Let's begin with the telehealth overview, which is the why, where, and who of the report. This tab was updated to provide a clear, less cluttered layout in order to be able to see key metrics quickly and easily. From a macro view, users are able to see telehealth services and their costs, and with our filters up top, we can select a specific time period, payer type, or telehealth type. This general overview also shows a heat map of Coloradans' telehealth costs and utilization based on their county of residence, as well as the top reasons for accessing telehealth, the top services, and the top types of providers who are providing telehealth specific services. As you can see in the key summary metrics, Colorado had nearly 1 million telehealth services, which accounted for approximately $1 billion of spending from January 2019 to January 2022. And we can still dive deeper. By selecting a specific county, users are able to view the cost and utilization for telehealth services in their specific county. At the county level, we're able to view even more details next to the map, which list the top reasons for seeking help, top services, and the main provider types. So if we're interested in Denver County's telehealth and telemedicine spending after the onset of the pandemic, we would be able to see that costs have significantly risen to nearly $490 per person. If we dig deeper, we could filter even further to see how these costs differ by coverage or payer type. What if we wanted to dig even deeper into the key details to the side of the page? We can do this with the services details page. This page was revamped based on user feedback. Since there is a high level of potential interactivity, we wanted to make the instructions clear and make the process of drilling down into the details clear. This page dives deeper into the top telehealth services, diagnoses, and provider types. The main value for this particular page is the capability to select a combination of filters and dig deeper into these specific metrics. When visiting this page, it may look overwhelming, which is why it's helpful to have a question in mind before exploring. For example, what if we asked, what were the main diagnoses for those seeking telehealth services from a primary care provider pre-pandemic? We can now see the top diagnoses for this specific population, can easily see what we've selected, and can reset our table selections easily when needed. We could also dig further and select multiple filters for a more specific question. If we were to ask, in the Colorado Springs Division of Insurance region, what percentage of primary care providers saw individuals with a mental health condition and specifically provided telehealth psychiatry services and procedures? By this point, we should have a good idea of the general cost and utilization of telehealth in Colorado. Yet, if we go ahead and click the Demographics Focus tab, we can uncover more as to who specifically is utilizing these services. This is an entirely new page based on feedback from users who wanted to explore demographic breakdowns of telehealth services. Once again, you'll notice we have our standard filters up top with time period, payer type, telehealth type, and division of insurance region. The big addition with this tab is the demographic categories, where we can select to see the telehealth data by age category, race and ethnicity, or sex. Below the demographics filter, we showcase each demographic's utilization rate, services per 1,000 persons, as well as trends over time. We can also isolate a specific demographic category in the bar chart to feature it in a clearer way in the trend chart below. In addition, we can see the top diagnoses for those seeking telehealth services for each category in the table, clearer way in the trend chart below. In addition, we can see the top diagnoses for those seeking telehealth services for each category in the table. A couple of examples of questions that could be answered on this page could be which race or ethnicity had the highest proportion of telehealth seekers, specifically with a mental health primary diagnosis? Or is there a division of insurance region where males utilize telehealth more than females? Or lastly, which age group predominantly uses telehealth services? Lastly, we have the Telehealth Trends tab. This last tab is not a new addition, but is extremely valuable to visualize telehealth over time and could be the best place to begin the journey with this report. Similar to the Overview tab, users can explore overall telehealth and utilization, but with a clear emphasis on time, when instant observation is the capitalistic side of healthcare clearly on display. Notice the cost of these services prior to the onset of COVID-19, and specifically the implementation of COVID-19 related changes in policy. We can also use this chart to look for trends from specific time periods. We notice the peak of telehealth services occurred in April of 2020, and a second jump in December of 2020, 1 month after the 2020 elections. This is just the tip of the iceberg for what you can explore in regards to telehealth trends. That concludes our overview of the Telehealth Services Analysis report. We hope that you have found this useful and have a better understanding of how to navigate the dashboards. If you have any questions or suggestions for future iterations, please email info@civic.org.